Have you ever wondered how loneliness may affect your health? Hello, my successful and healthy earthlings. Mihaela Ragush here, naturopath and founder of the Natural Health Podcast. In this episode today, you're going to learn all things loneliness and exactly how it affects your health. We're going to go through maybe why you're lonely, some countries that are the loneliness, that's exactly what you'll find out, and then the health effects of loneliness, and at the end, the 3 tips what you can do if you are lonely. And at the end of this episode, I'm going to give you an opportunity to join a health and success oriented community by clicking below and joining the Natural Health newsletter. Welcome to the Natural Podcast, where we bring awareness of sustainable health in the business hustle space. Natural Podcast is perfect for the high-performing, business-minded individuals who want to work with their biochemistry to achieve success and optimal health. It's Mondays with Mihaela. That's right, me. Thank you so much for tuning in. Absolutely love, and appreciate your support. On Mondays, I'm here to provide you with simple, savvy, and sustainable health hacks to optimize your health. And if you're looking to understand what loneliness is all about, you've come to the right channel, you've come to the right video. Because today, I'm going to be talking to you about loneliness. It's not the most exciting subject, I know. It's definitely not a subject that a lot of people talk about. I mean, think about last time you spoke to your friends or family about loneliness. It's probably something that you keep to yourself. Maybe because you may be feeling lonely or you know someone who is lonely. So, why are you lonely? And what's happening around the world? What countries are the most loneliness? Let's look into it. Essentially, loneliness, right, if we look at it scientifically, has been conceptualized as the individual's subjective experience about the generalized lack of satisfying human relationships. That's kind of like the definition of loneliness that the sciencey people are going with. So it's having a lack of satisfaction with human relationships. But we are made to be social. We are made to interact with each other. But what happens when we don't? And we've seen throughout the years that this has dropped. You may have hung out with your friends a lot more, with your family, with your neighbors. And now, because of everything that's been happening, we are scared to hang out with people and have satisfying human relationships. A recent article has shown that the prevalence of loneliness in European countries ranks from 10% in Western and Northern countries and 55% in Eastern countries. A report conducted in the United Kingdom suggested that if loneliness is not considered as a relevant priority, in 2030, depression and other health problems may increase given the association with loneliness. And we know depression is a huge mental health issue, followed by anxiety and so forth. So loneliness is a contributing factor to it. So I looked at a page and it summarized statistics and data from major surveys on loneliness and isolation in America between 2016 and 2021. It didn't only look at America, it looked at other countries. So let's have a look, right? In 2020, 9.3% of Americans report not having friends or relatives they can count on. Wow, that hurts. Not having someone that you can count on. Nearly 10% of individuals in America feel that way. Let's have a look at other countries. The same number for the UK is 6%. Denmark, 4.5%. Iceland, a low of 2.4%. Israel, 9.4%. Greece, 21.7%. Mexico, 14.9%. These are the individuals that believe they don't have a friend or relative they can count on, which includes being lonely. 36% of Americans say they felt more lonely than usual during this pandemic. 50% say there has been no significant impact, and 9% say they've felt less lonely than usual. One survey asked people from around the globe how often they felt lonely. The number of people who said they felt lonely often, always, or some of the other time varied by country. I'm going to name a few countries and I'll give you a few percentages we can look at here. We'll give you a list also that you can look at if I do miss out on some countries that you may be interested in. Brazil was a whopping 50%, Turkey 46%, India, followed by Saudi Arabia, Italy 41%, South Africa 40%, Malaysia 39%, followed by Chile, South Korea, Peru, France, Argentina, Great Britain at 34%, followed by Mexico, Canada, United States at 31%, and then followed by Australia at 30%, and then other countries that you can see. One of the lowest ones being Netherlands at 15% and Japan at 16%. That's looking at people on these surveys that said that they felt lonely. Okay, a large amount of people. Overall, 33% of adults across 29 countries in the survey experienced loneliness. The countries with the highest number of people who declared they never or hardly ever felt lonely, these 3 countries, right? These are the people saying that they hardly ever or never felt lonely. Whopping 55% are the Netherlands. That's crazy. Germany at 50% and Russia at 49%. That is some interesting statistics right there. So I wonder what's different in the Netherlands. I wonder what's different in Germany and Russia. I think I remember watching a documentary in the Netherlands how they create community hubs. I think it was in the Netherlands, I'm not 100% sure, where they created community hubs where the elderly would hang out with. So one of the hubs was the elderly would hang out with kids, looking after the kids. So instead of taking a kid to a kindergarten, you take him to this community center of elderly people, and of course they'll have other people there with them, but the elderly people would look after these kids, so therefore they increase their happiness and they weren't as lonely. And the other one was if there's any single mothers, single fathers, single parents, carers, they created a community. So it's kind of like in this building, everyone has their own rooms, and then they have a communal kitchen, and then once a week someone cooks. So every week you have home cooked meals, but it's everyone different turn, right? And you all put your money in together. It's kind of communal living. Maybe that is a reason why they're never or hardly ever lonely. In the survey undertaken since the onset of the pandemic, just over half, which is 54% of respondents reported they felt more lonely since the start of the pandemic. So we can see what is happening with loneliness right here in Australia and all around the world from this pandemic. Young people were more likely than other age groups to have felt higher levels of loneliness through the pandemic. The proportion of respondents aged 18 to 24 who experienced loneliness most or all the time decreased actually from April 2020, which was 12% to 9%, but then in August 2021 increased to a whopping 14%. So it goes up and down, right, depending on what's happening. The proportion of respondents aged 18 to 24 who experienced loneliness some or little of the time decreased from 32% to 26% from April 2020 to August 2021. So less people are actually feeling like they're experience loneliness some or little of the time. So more people are feeling lonely, essentially the opposite way. So as we've seen with these statistics, I wanted to show them here. I'm pretty sure there's other statistics out there. It's not just this one study that I found or this report that I found. But what we are seeing here is a lot of individuals feeling like they don't have that community connection, they're unsatisfied with the human connection that they have. And I've done a video previously, maybe even 2 years ago, about the human touch, how necessary it is. And I know you're like, human touch, loneliness, but it's linked, right? It's absolutely linked. So let's have a look at the health effects of loneliness. So now that we've figured out that nearly everyone except Russia, Netherlands and Germany are feeling loneliness, even though some of them do feel lonely, but they're less lonely there. Let's have a look at how it actually affects your health and why we should be actually thinking about these things as a community, as a country, as a whole world. So according to previous articles, loneliness has significant implication on several physical and mental health issues, such as depression, alcoholism, cardiovascular problems, sleep difficulties, alterations in the immunological system, Alzheimer's disease, and health status in general. An increasing body of research has shown that loneliness is also associated with early mortality. That is mind-blowing. So they're saying here that there's a link between feeling lonely and being lonely and death. When was the last time your doctor prescribed hanging out with family or friends? When was the last time your practitioner said to you, hey, maybe you should go and go to a social event and be social? When was the last time someone asked you, how is your social life? A healthcare professional. They probably don't, because it's not something that they consider. But it is directly linked to your health. There's a study that looked at longitudinal association between loneliness, social isolation, and cardiovascular events. Okay. So the objective of the study was aimed to examine the association between loneliness, social isolation, a lot of that has occurred lately, and cardiovascular disease, looking at both self-reported CVD diagnoses and related hospital admissions. So there's results there, and it goes into detail. Male in the age was 64 years old, about 45% were men. Okay, let's have a look at what were the results. You can have a look at the study if you want. The results were, our findings provide strong evidence in a relationship between loneliness and cardiovascular events. Loneliness should be considered as a psychosocial risk factor for cardiovascular disease in both research and interventions for cardiovascular prevention. So if someone in your family has had heart issues, or you yourself have heart issues, a preventative is not to be lonely. You probably haven't heard this anywhere before. It's probably new to you. You're like, what? Really? Yes, I'm here to tell you that if you want to stay away from getting cardiovascular disease or a heart attack, don't be lonely. There's another study which was actually a meta-analysis in 2018 in the Public Library of Science 1, which was the association of loneliness with all-cause mortality, and this is the one that blows my mind, right? A total of 35 articles involving 220,000 participants were included in a systematic review. Loneliness is a risk factor for all-cause mortality. Loneliness shows a harmful effect for all-cause mortality, and the effect is slightly stronger in men than in women. Moreover, the impact of loneliness was independent from the quality evaluation of each article and effects of depression. Okay, let's have a look at what they came out with. These are some statistics. Mind-blowing. 26% increase in the likelihood of mortality among individuals who felt lonely. This was one study that found that. 45% increased risk of mortality in seniors who are lonely. Can you see it goes up the older you get? And who's the most loneliness? The elderly. Who are left behind? The elderly. Okay. 29% increased risk of heart disease in individuals with poor social relationships. Poor social relationships, meaning you may have some relationships, but they may be poor. 32% increased risk of stroke in individuals with poor social relationships. These are some staggering, huge numbers. Loneliness and isolation have similar effects on health, as being obese and alcoholic or smoking 15 cigarettes per day. Loneliness is more harmful than not exercising. This is absolutely crazy, these statistics. And they blow my mind. And these are studies done in 2010, 2019, 2016, 2010 again. So I wonder what the statistics are going to be like in the next few years after we have been isolated, socially isolated. It's interesting that they called it social isolation. They didn't call it physical isolation, because it is killing us. Isolation, loneliness kills us. I know it's a bit morbid of me to say, but the statistics follow it. The statistics say so. And I'm pretty sure you have felt that when you feel lonely, not around individuals, and just, you're not yourself. You have those down days and you just want to be around people. I mean, think about the last time you hung out with your friends and family, that laughter, that energy, the happiness. You went home and you're like, oh my gosh, I feel so energized. I feel so powerful. I feel fulfilled in my heart, right? So essentially, if you want to know a little bit more, here's a little bit more. Social isolation and loneliness is a risk for premature death. The risk of premature death associated with social isolation and loneliness is similar to the risk of premature death associated with low-known risks such as obesity, based on a meta-analysis of research in Europe, North America, Australia, and Asia in 2015. Now that I've bombarded you with all that information, let's have a look at 3 tips to not be lonely. Number 1, don't confuse being alone with being lonely. You're like, what does that mean? Okay, being alone by yourself doesn't mean that you're lonely. You can still be lonely surrounded by individuals. Okay, so essentially what I'm trying to say is don't be scared of being alone. That doesn't mean you're lonely. Define the definition for yourself, what it means to be alone, spending some time alone, and being lonely. Okay, being lonely, it means not having the social support around you and those relationships that satisfy you around you. Number 2, reach out, right? Reach out for help, support. If you're feeling lonely and if you know you've understood what the definition means for you and what loneliness means for you, reach out for support, right? Call your mates, call your family, and if you don't want to call any of them, join a community support group, join a community, get involved in some sports, get involved in some art classes, some cooking classes, something that you enjoy, and be involved, right? Because community is everything. Number 3 is be social with friends, family, co-workers, community, and so forth, right? If you're a hard worker and you're just working because you believe in your business so much and you just want to smash it out, and then someone calls you and goes, you want to hang out, and you go no because you want to do your work, think about the effects that has on your health. Because I always blab on about how important it is for us to be healthy, to be successful. But if you're going to stay up doing work and turn down an opportunity of hanging out with your friends and family to create that social environment, which essentially is going to protect you from heart disease, protect you from premature death, why wouldn't you choose that, right? So just think about it. So I hope that you took away something from this podcast and episode, and I hope that you share this episode with loved ones around you so they understand the importance of being social and the importance of having social support around you. And if you want to join a health and success community, talking about communities, click below, join the Natural Health newsletter and be part of a health and success community. Every Friday, you'll be dropped bonuses, specials into your inbox just for you. Do what you do best, love, like, share the Natural Health podcast, and remember the missing link between failure and success is your health. Content and information provided here is opinion of Mahela Raguse and is for information purposes only and does not constitute medical advice. It is not intended to provide medical advice or take the place of medical advice or any current treatment you're undertaking. Consult your own medical professionals for any medical issues that you may be having. This entire disclaimer also applies to any guests or contributors to the Natural Health podcast. It is advised that you consult your doctor or healthcare professional in relation to any health concerns you may be having. Mahela Raguse does not take responsibility for any health consequences which occur from a person listening, viewing, or reading this content. Under no circumstances shall the Natural Podcast, Mahela Raguse, any guests or contributors to the Natural Podcast, or any employees, associates, or affiliates of Mahela Raguse be responsible for damages arising from the information provided on the Natural Podcast. By listening to this podcast, you agree not to use this podcast as medical advice to treat any medical conditions in either yourself or others. Please note, if you're taking prescription, do not stop your medication or start a new protocol, including but not limited to supplements, diet, lifestyle changes without consulting your doctor or healthcare professional. If you or any person has a medical concern, you should consult with your healthcare provider or seek other professional medical advice. Never disregard professional medical advice or delay in seeking it because of something that you have read or heard on the Natural Podcast or in any linked materials. If you think you may have a medical emergency, call your doctor or emergency services immediately. Neither Mahela Raguse nor the publisher of this content takes responsibility for the possible health consequences of any person or persons reading or listening or following the information in the educational content.